Have you ever woken up in the morning feeling like your mouth is completely dry? Maybe your tongue feels like sandpaper. Maybe your lips are dry and cracked. Or maybe the very first thing you do every morning is reach for a glass of water before your feet even hit the floor. If you're over 60, you're not alone. Millions of older adults deal with dry mouth on a regular basis. In fact, many people simply assume it's a normal part of getting older. But here's the question. What if it isn't? What if that dry mouth is actually your body's way of warning you that something else is going on? The truth is, persistent dry mouth can sometimes be a sign of underlying health issues that deserve attention. And in many cases, recognizing those warning signs early can help you avoid bigger problems down the road. So today, we're going to take a closer look at what morning dry mouth may be telling you about your health after 60, and why it's a symptom you shouldn't ignore. Let's start with the basics. Most people rarely think about saliva, but your body depends on it more than you might realize. Saliva does far more than simply keep your mouth comfortable. It helps protect your teeth from decay, supports healthy digestion, washes away food particles, controls harmful bacteria, and keeps the tissues inside your mouth healthy and lubricated. Your body produces saliva 24 hours a day. However, during sleep, saliva production naturally slows down. That's completely normal. That's why it's common to wake up with a slightly dry mouth every now and then. But if you're waking up every morning with a mouth that feels extremely dry, sticky, or uncomfortable, there may be more to the story. One of the most common causes is dehydration. As we age, our sense of thirst changes. Many older adults don't feel thirsty as often as they did when they were younger, even when their bodies need more fluids. As a result, mild dehydration can develop without obvious warning signs. When your body doesn't have enough water available, it begins conserving fluids. One way it does that is by reducing saliva production. The result? You wake up with a dry mouth. If dehydration is contributing to the problem, you may also notice symptoms like fatigue, dizziness, headaches, muscle cramps, dry skin, or dark-colored urine. The good news is that staying hydrated throughout the day can often make a significant difference. Instead of trying to drink large amounts of water right before bed, focus on maintaining consistent hydration during the day. Another possible cause of dry mouth is mouth breathing. Many people sleep with their mouths open and have no idea they're doing it. This can happen because of allergies, chronic nasal congestion, sinus problems, or structural issues that make it harder to breathe through the nose. When air continuously flows through your mouth while you sleep, moisture evaporates much more quickly. By morning, your mouth can feel extremely dry. Some people also wake up with a sore throat, bad breath, or a strong sense of thirst. If that sounds familiar, mouth breathing could be playing a role. And that leads us to another important health condition that often goes undiagnosed: sleep apnea. Sleep apnea affects millions of Americans, especially adults over the age of 60. It's a condition in which breathing repeatedly stops and starts throughout the night. Many people don't even realize it's happening. Common symptoms include loud snoring, gasping for air during sleep, waking up frequently throughout the night, morning headaches, memory problems, and excessive daytime fatigue. Dry mouth is also a very common symptom. Why? Because many people with sleep apnea spend much of the night breathing through their mouths. As a result, they often wake up with significant dryness and discomfort. If you're consistently waking up tired despite getting a full night's sleep, and especially if someone has told you that you snore loudly, it may be worth talking to your doctor about a sleep evaluation. Now let's discuss another major contributor to dry mouth that many seniors never suspect: medications. In fact, medications are one of the leading causes of chronic dry mouth in older adults. Hundreds of commonly prescribed medications list dry mouth as a potential side effect. These include certain medications used to treat high blood pressure, allergies, anxiety, depression, overactive bladder, insomnia, and chronic pain. Sometimes people assume aging itself is responsible for their symptoms when the real cause is a medication they've been taking for months or even years. That's why it's important to review your medications with your healthcare provider if dry mouth becomes persistent. A simple adjustment may help reduce the problem. Dry mouth can also sometimes be linked to blood sugar issues. When blood sugar levels remain elevated, the body works harder to remove excess glucose through urine. This process can increase fluid loss and contribute to dehydration. As a result, people with diabetes or prediabetes often experience excessive thirst and dry mouth. Other symptoms may include frequent urination, unexplained fatigue, blurred vision, increased hunger, or slow healing cuts and wounds. Dry mouth alone doesn't mean you have diabetes. However, when combined with other symptoms, it can be an important warning sign that shouldn't be ignored. Now let's talk about something many people overlook: your oral health. Saliva is one of your body's natural defense systems. It helps neutralize harmful acids, control bacteria, and protect your teeth and gums. When saliva levels remain low for long periods of time, bacteria can multiply more easily. This increases the risk of cavities, gum disease, bad breath, oral infections, and tooth loss. That's one reason why chronic dry mouth deserves attention. It's not just uncomfortable, it can directly affect your long-term dental health. And as we age, maintaining healthy teeth and gums becomes increasingly important for nutrition, overall health, confidence, and quality of life. So what can you do if you regularly wake up with a dry mouth? Start by taking a closer look at your hydration habits. Make sure you're drinking enough water throughout the day. Pay attention to whether nasal congestion may be causing you to breathe through your mouth at night. Watch for symptoms like loud snoring, daytime sleepiness, or frequent awakenings that could point to a sleep disorder. Review your medications with your healthcare provider. And don't skip regular dental checkups. Dentists are often among the first healthcare professionals to recognize the signs of chronic dry mouth and the complications it can cause. Here's the most important takeaway. Your body often gives you small warning signs before larger health problems develop. Dry mouth may seem like a minor annoyance, but it can provide valuable clues about hydration, sleep quality, medication side effects, blood sugar control, and overall health. So the next time you wake up with a dry mouth, don't automatically assume it's just part of getting older. Instead, consider it a signal worth paying attention to. Because listening to your body today could help you stay healthier, more comfortable, and more independent in the years ahead. If you found this information helpful, be sure to like this video, subscribe to the channel, and turn on notifications for more health and healthy aging tips designed specifically for adults over 60.